Hi everyone, thank you for joining. This is an emergency department discharge center to improve comprehension of discharge instructions and care coordination, presented by Nancy Kwon, Sarah Jacobs, and Marina Gizzi. So some background on our innovation: it took place at Long Island Jewish Medical Center's emergency department. We are an urban academic tertiary care emergency department within the Northwell Health System, which is the largest healthcare system in the Northeast with 23 hospitals and 18 emergency departments. Our volume is actually the highest in this system, with seeing over 100,000 patients per year in our emergency departments. We serve the greater Long Island, New York City, and Queens area, and we have a diverse patient population. All of these conditions lead to a set of challenges when we consider transitioning care and access to primary care for our patients. The literature supports that patients frequently do not understand their ED discharge instructions, even when English speaking. The discharge process also does not always incorporate best practices, as you could see a few listed on our slide. And in a busy, high-volume emergency department like ourselves, time is a factor. And with this, we decided to create a discharge center.
So just a little background for the Emergency Department Discharge Center. This is an innovation using grant funding from DSRIP, which is the Delivery System Reform Incentive Payment Program. This is Medicaid funding, and the goal is to bend the Medicaid curve by reducing things like readmissions. The ED Discharge Center is a model that provides a conceptual framework for the entire discharge process. In order to set up this conceptual framework, the funding resulted in a discharge center nurse, a patient access representative in order to make appointments, a care coordinator to provide care coordination both during and after the patient's visit from the emergency department, and a renovation of the emergency department space. So some of the overall goals of the ED Discharge Center are to improve the overall discharge process of patients who present to the ED, especially vulnerable patient populations, such as those with low health literacy and limited English proficiency, and to provide a coordination of the care, not only in the emergency department, but beyond. We would also utilize the Discharge Center to integrate other programs that already exist, such as those listed below.
So due to the district funding, we were able to receive $800,000, which allowed us to have renovations within the discharge center along with the staffing needs. So in this slide, you would be able to see the before and after pictures of the area where we see most of our treat and release patients in the emergency department, and it gives us a conceptual and more aesthetic look. And in this slide, you will see the discharge lounge. Some of our discharge lounge employees are patient access representative and care coordinator assistant. And in the last image, you could see the patient pod. So the process for the ED discharge lounge, this is our process map with our 4 key players for the discharge process, which is our ED provider, the discharge RN, our patient access representative and care coordinator assistant. So the patient is identified as eligible for the ED discharge lounge by the ED provider, whose then discharge RN helps with explaining discharge instructions with the patient, and the patient access coordinates with the patient and helps assist serve follow-up appointments, and when their care coordinator provides callbacks and connects patients to resources. Some of the challenges we faced in implementing the discharge center would be, unfortunately, the COVID-19 pandemic. This pushed back our go-live date for the staff to start the process.
In addition, funding for the discharge center ends in 2020 from DSRIP, so we will need to find some bridge funding to continue a very important program.
So since our go live in June of 2020, we have pulled some data. We've had 181 referrals from providers, 154 touch points with patients, 164 appointments were made, and we've done 96 callbacks. So here's a breakdown of the referral services that we've referred to so far in the discharge lounge. As you can see, it's many different services, but orthopedic and gastro being our top contenders. So next steps and future directions for the discharge lounge would be defining additional measures of success and method for tracking. We'll continue to data collect. We'll create dashboards and patient experience for pre and post questions specific to the discharge and follow-up care.
In addition, we want to continue to collaborate with others to build upon the conceptual framework that exists. So, for example, Health Solutions is our population health entity that we've collaborated with before, who would be able to provide telehealth services to provide some care management to the patients who are discharged. In addition, the Center for EMS for Northwell Health would be able to do some telehealth medical visits to follow up patients to ascertain that they understand their discharge instructions. And the Center for Health Equity is very interested in partnering with us in order to provide some health equity for our patients, and the Discharge Center helps to function to do this.
Some of the outcomes we can measure from the Discharge Center include patient comprehension of their discharge instructions, adherence to their follow-up appointments, 72-hour returns and ED revisits, patient satisfaction with their care, and adherence to medications.
So in summary, the ED setting is under increased pressure to care for patients safely and efficiently. Physicians were hired to support the framework, collaboration with others to build upon the conceptual framework, and the renovation to include an area that supports the discharge lounge process.
Thank you.